think about COVID. In the initial part of COVID, there were a few challenges. And one of those challenges were internationally the lack of capacity to test. Right? You remember that quite well. In the US, in China, there were challenges with testing. You remember that quite clearly. I'm sure all of you in the room remember that, correct? Right, good. So, at that point, what we knew was that people can convert the disease, or the time span between where people, almost all the population will convert, is somewhere between 4 or 5 days.
When you say convert, you mean become
infectious?
convert?
No. So go from a negative to a positive disease. We've also learned as well, and this is why science has to drive what people do. We've also learned that just before that period and just after that period, that you're the most infective in terms of your state. Now, the incubation period of 14 days is a very important discussion. And the incubation period of 14 days, which was laid down, if you go back and look at all the international data, what's out there, it will tell you that within that 14-day period, people weren't being tested. So it was just as he said, if you don't want to get tested, we will put you out for 14 days as a security. Since then, we have now learned that data coming out of, always follow the science, right? Data coming out of Singapore, brilliant data coming out of Singapore, of many studies, we have learned that past day 8, day 9, even though my PCR test, which is the gold standard test, may be positive, right? When they look and culture the virus in the lab. Culture, for those in the public who don't understand, means you put it on a plate and you grow it. You don't do that in Barbados, and there are not many places in the world who will do that. It's quite a dangerous thing to do. It's done for study purposes. So we now know at that period, right, you cannot actually spread the disease because the PCR test does not differentiate between live, I've mentioned this before, between a live virus and dead virus, for which people call it, you see it in the article saying shedding of the virus. So that becomes a very important point as well. So if you go back now to put the story together, the majority of people will convert between day 4, day 5, and I think it was borne out quite interestingly in this particular case, because these individuals were coming from a high-risk setting. They were among people who were high risk, and they, if you look to see the last 3 who converted right within that period, which is exactly what we expected to have happened. So testing certainly at day 7, you really are on the low, especially when your exposure rate or exposure possibility is low. The probability of you developing COVID after that is extremely low. And this, I hope you understand what I'm saying, because it's very. I think it's important that the public understands that particular concept. I think in everything we do, we always have to follow the science of the disease.